Morning time now is 9:12. Over 13,000 cases of the flu have been reported in San Diego, and unfortunately many of those are kids. Dr. Chaffoo joining us now on how to protect your children, protect yourself, protect everyone.
Exactly.
I walked into the doctor yesterday and I leaned over to the nurse and I said, has anybody with the flu been in here today? Because my hands were up and I was going to put a mask on.
Of course.
I've heard so many stories about people going in to see the doctor and they leave and they have the flu.
You're right, and the big thing, Shally, the take-home message is that if you're not well, if you're sick, you certainly don't want to go somewhere where there are a lot of people, especially children, get someone else ill.
Okay, so exactly the flu type that's on the rise is flu type B?
It's, well, there's a combination. Certainly B is on the rise. It's the milder form.
Okay.
But we also have type A. The type A and B are the most common forms of flu that we're seeing this season.
So for the average person who could be watching right now, what is the difference between a type A flu and a type B flu?
Well, so the difference is really severity of symptoms. So B usually, at least this year, started early on and is milder symptoms, and the type A is this later strain that's coming that seems to be more severe symptoms.
Have we even hit the peak of flu
We may
season?
not have hit the peak. That's the problem. And I think people have this sense of security. Well, gosh, you know, I haven't gotten ill. I don't really need to get the flu shot now. The flu season's over. That may not necessarily be the case.
So if you have not gotten the flu shot, we're coming into February now.
Yes.
You say,
Get the flu shot.
Go get it.
Absolutely. The American Academy of Pediatrics and the CDC have both come down clearly on this issue. And the #1 take-home message is vaccination, not just for kids, but for adults.
What if you did get the flu last year, October, November, and now we're, in 2018? Can you get the flu again?
You can, because it could be a different strain. And remember that the vaccination, experts say, is only effective about 60% of the time. But what it does do is reduce the severity of the symptoms and therefore probably some of the complications that can cause death in people.
And this particular vaccine, which strain is it protecting you
So it's for
against?
type A and type B, which are the two most common strains.
Okay. Speaking of the kids, I mean, there was news last week that there was a 1-year-old who passed away from the flu. They're so vulnerable,
very vulnerable,
as well as the elderly.
Yes.
So why the children? Why does this affect children so much?
Shally, the reason being that there's just, as you said, there's less of a reserve. Children tend to get more serious complications of flu, like pneumonia, like meningitis, unfortunately. They're more likely to get some of the GI symptoms like dehydration, from vomiting or from diarrhea. And so they have less of a reserve than you and I do. They're more likely to get into shock.
And preventing the spread. I know we have some advice there that we have up on the screen for our friends at home to watch. I mean, obviously washing your hands.
Frequently washing your hands.
Okay, what else are things parents can do to protect their kids?
The big things are obviously, if you have to cough or sneeze, do that into your elbow, not in your hand, because that gets passed along. Vaccination, and then watch your children. If they do get an illness and they have a high fever, don't just dismiss that. If the fever doesn't go away or certainly continues, it may indicate a secondary infection, may indicate a serious ear infection, meningitis, pneumonia, something you don't want to just pass off. You want to get in and see your doctor early on to get treatment for that.
And I think one of the biggest things, which is very hard for parents because they have to work, is that if your kid is sick or if you're sick yourself, is don't go to school and don't go to work.
In fact, they even say that if you have a fever, you want to have at least 24 hours without a fever before you go in, because you're still infective during that period of time.
Oh, really good advice. I hope this season comes to an end soon.
Hope so.
Keeping our fingers crossed.
Exactly.
Dr. Chaffoo, thank you for being here.
Thank you, Charlie.
All right, 9:16.